Lesson 8, CPR and First Aid. Today we're going to go over wounds, head, neck, and spine injuries. Wounds. What are wounds? Wounds include breathing from the nose, mouth, tooth injuries, eye injuries, penetrating and puncturing objects, and amputation. Bleeding from the nose, so the medical name for this is nosebleeds and epistaxis. What causes nosebleeds? So most nosebleeds are spontaneous, which means they occur without warning or without known reason. However, if you do frequently experience nosebleeds, there may be a known reason, and they may be caused by infection, injury, allergic reaction, nose picking, or an object being pushed into the nostril. So steps to respond to a nosebleed: make sure the scene is safe, press both sides of the nostrils while the person sits and leans forward. Remember, leans forward. There's many information where people say lean back, but then the blood will go back and into it, but lean forward. And place constant pressure on both sides of the nostril for a few minutes until the bleeding stops. If the bleeding continues, press harder and phone 911 if you can't stop the bleeding. In about 15 minutes, the bleeding is heavy, such as gushing blood, and the person has trouble breathing. So here's a video. Bleeding from the mouth. So you can usually stop bleeding from the mouth with pressure. And what causes mouth bleeding? It's usually not a cause for concern. However, it can be sometimes if it's severe illness that requires medical attention. So make sure the scene is safe. If you can easily reach the bleeding, apply pressure to the area with dressing such as gauze, and phone 911 if you can't stop the bleeding or if the person has trouble breathing. Here's an image. Tooth injuries. A person with a mouth injury may have broken, loosened, or knocked out a tooth. This can be a choking hazard. So types of tooth injuries include all of these. And step 2, responding to a tooth injury. Make sure the scene is safe. Check the mouth for any missing teeth, loose teeth, or parts of teeth. Clean the wound with saline or clean water. If the tooth is loose, have the person bite down on a piece of gauze to keep the tooth in place and call a dentist. If the tooth is chipped, gently clean the injured area and call a dentist. Apply pressure with gauze to stop any bleeding. That the empty tooth socket. If the tooth has come out, put the tooth in a cup of milk or clean water and immediately take the injured person and tooth to a dentist or emergency department. Talk to the person with the dentist if the tooth changes color after an injury. So make sure to always hold the tooth by the crown and not the root, the part that was in the gums, as there may be ligaments on the tooth that will help reattach to the tooth. So here's a video. Eye injuries. Eye injuries may include bruises, punctures, and scratches, and it can happen for various reasons. Signs of an eye injury: pain, trouble seeing, bruising, bleeding, redness, and swelling. Responding to eye injuries: make sure the scene is safe, get the first aid kit, wear PPE, phone EMS if the eye is hit hard or punctured, and tell the person to keep their eyes closed. If there's an irritant such as sand in the eye, use water to rinse the eye. If the irritant does not come out or the person is in extreme pain, phone EMS and tell the person to keep their eyes closed. Video. Penetrating and puncturing objects. An object such as a knife or sharp stick can wound a person by penetrating the body or puncturing the skin. So if there is an object stuck in the body, leave it in the body, as taking it out may cause more damage. So steps: make sure to stay safe, wear PPE, get the first aid kit, phone EMS, stop any bleeding you can see, and try to keep the injured person from moving. Amputation. So amputation, known as when a part of the body such as a finger, toe, or hand or foot is cut off. Amputation may result from trauma, surgery, and congenital amputation. If a part of the body is amputated, save the body part because doctors may be able to retouch it. You can preserve a detached body part at room temperature, but it is better and it will be in better condition to be retouched if you keep it cool. So to protect an amputated part, rinse the amputated part in clean water, cover or wrap the amputated part with a clean dressing if it can fit. Place the amputated part in a watertight plastic bag. Place a bag in another container with ice and water. Label it with the injured person's name, date, and time. Make sure to send to the hospital with the injured person. Other wounds, so open wounds and blisters, closed wounds, and gunshot wounds. An open wound is a break in the skin surface resulting in external bleeding. Types of open wounds include abrasions. The top layer of the skin is removed with little or no blood loss. Examples: scrape, road rash, and scuff. Lacerations include cut skin with jagged and irregular edges. Open wounds continue. So, open wound is a break into the skin surface resulting from external bleeding. Types of open wounds include incisions, punctures, and avulsions. A blister is a collection of fluid in a bubble under the outer layer of the skin, so the epidermis, and may happen between like rubbing a socket foot, which causes stress on the skin surface because the underlying supporting tissue becomes stationary. The stress separates the skin into two layers, and the resulting space fills with fluid. Head, neck, and spine injuries. So, important info: you may cause further injury to the spinal cord if you bend, twist, or turn a person's head or neck with a head, neck, or spinal injury. When you give first aid to someone with a possible spine injury, you must not bend, twist, or turn the head or neck unless it's necessary to provide CPR or if you need to move the person out of danger. If the injured person is vomiting or had fluids in their mouth, wear PPE and roll them to their side. When should you expect a head injury? So causes, so obvious reasons: fell from height, was hit in the head, was injured while driving, etc., etc. So find one sign of a head injury: it does not respond or only moans and moves, acts sleepy or confused, vomits, complains of headache, trouble seeing, trouble walking, has a seizure. Here's a video. Neck and spine injury. The bones of the spine protect the spinal cord. The spinal cord carries messages between the brain and the body. If the spine is damaged, the spinal cord may be injured as well. When should you expect a neck or spine injury? Is 65 years or older, was in a car or bicycle crash, has fallen from height, etc., etc. How do you help someone with a neck, head, or spinal injury? Make sure the scene is safe. Phone, EMS, minimize movement of the head and neck. So hold the head and neck to minimize movement. Here's the video.
When someone has a spinal injury, the greatest risk is their spinal cord may be temporarily.
And that is the last part of the lesson today.